Hey, everybody. This is Andrea Paquette. I'm president and co-founder of Stigma-Free Mental Health Society, and I am so excited to have another episode of our Stigma-Free Voices podcast on Spotify, on YouTube, Facebook, and also shown live on LinkedIn. If you are watching now, please share, and if you are watching later, please do the same. So I am over the moon to be connecting again with Dr. Daniel To. And how are you doing today? Let our viewers know where you're coming in from.
So good. I'm coming from my house in Coquitlam. It's summer, so school is out, and we're on the unceded traditional territories of the Coquitlam First Nation. And I also do my work in the New Westminster School District in the unceded traditional territories of the Kakak First Nation. So happy to be here with you. I'm excited. I don't know if I should have worn a blue shirt with a blue background, but see, my arms disappear during this blue background. So I'm maybe not going to raise my hands because my shirt doesn't really go with the background. Yeah.
I think it looks great and it does match very well. So we'll just go with that. No problem. Yeah. So Daniel has actually been working very closely with Stigma-Free over the last decade and was one of the key pillars of getting us into the Surrey school district as much as we have. So we're so grateful for your contributions and for being here today. So I thought I could just start off with a bio so I can share a little bit about you, and then we'll jump into some questions. Sound good?
Sure. Sounds great. Okay. And don't forget, you can now come into the New West School District as well.
Oh, it's in there. You bet.
Just stay in Surrey, so,
Yeah. Okay. So Dr. Daniel To is an experienced educator, consultant, and leader in mental health, wellness, and educational leadership. He previously served as the district rep for mental health and wellness programming in the Surrey School District, where he oversaw initiatives supporting youth at risk, vulnerable learners, student mental health, integrated child and youth teams, and crisis response as well. He has also served on interagency and intergovernmental committees focused on improving outcomes for students with mental health needs. And currently, Dr. To is a proud member of New Westminster Schools. And he's also, yes, we got that, and also a professor in the Master of Arts in Leadership program at Trinity Western University. Providing program facilitation, public communications for Global Civic Policy Society, and is a member of the Center for Leading Research in Education at Wilfrid Laurier University. Wow, you're doing a lot. This is
I think you got it all. There's also a project I'm doing with skills trades and with some partners in helping youth get into the trades. So that is ongoing and about to start. It's a little bit more hush-hush, so I can't really go into it. But maybe if you have me on your podcast in 2 months, I can go more into it.
Yeah, no, we'll definitely have to follow up on that. And then just lastly, that you're very passionate about reducing mental health stigma and strengthening school communities, committed to helping educators, families, and leaders create environments where all children can thrive. And above all, a proud father of 2 and grateful for the support of his incredible life partner.
Yeah, Michelle's awesome. The best.
And always behind you.
She'll probably watch this one time somewhere. And she'll probably only watch the first 5 minutes. So Michelle, you're awesome. I have to say that right now before you click it off,
So good. Okay, so let's jump into it. So you've spent years working to improve mental health literacy in schools and communities. So let's go back. What first inspired you to create this as like a huge central focus of your work?
I think I can point to 2 things. And interestingly enough, a lot of people get into the work that I did and still do came from that environment. And I actually came from the opposite. So if you're familiar with my story, if you go back to the Surrey School District Mental Health YouTube, which I think they still kept that up there and it's still on there. I came from a very privileged background, right? My family was super supportive. If I did an ACEs test, I probably wouldn't score. And, I've been in a very privileged position of maybe growing up in a way that I was fully supported from all angles, faith-based, great family, strong Chinese, Asian, Canadian culture, right? So all the things were my favorite to be successful. And I think I was. But when I look out and I see young people, even if we're talking about just the average Canadian who with a family income that's striving to make it, there are a lot of struggling families out there that didn't have the things that benefited me to move forward. And I thought to myself, when you look at families and they don't have the supports and they don't have things that surrounded them and wrapped around them to let them lead to success, what then? When they don't have the best of everything, what then? Right? And when you look at, and it's not just the vulnerable and the poor, although that's a population I'm so passionate about serving, but it's really even people in jobs that struggle to pay their mortgage, people living paycheck to paycheck. Well, how did their kids get into sports? How did their kids pay for university? How did their kids learn to drive? Right? All of that costs money. So when I look at that and look at how governmental social services and how nonprofits can really take part in supporting families from like sort of middle-class families and everyone who struggles in our community, in our province, in our nation, in our city, that's what drove me to really truly be passionate about the work about serving young people and families so that they could thrive and be successful. And that started around 2014, 2015 when I had that epiphany. But the other thing for me was, and I think anybody's watched any part of anything I've done, especially when I did a podcast for the Stigma-Free Society, I struggle with mental health myself as well, right? Struggle with that need to be perfect. Struggle with making sure I look good and feel good and present well all the time. Well, that is a struggle. That is something that that is quite difficult to do, and keeping that image up was very, very stressful for me. And having sort of mental health issues when I became a young adult, and when I became an adult, and really struggling to sort of find that balance in my life, was something that really. I don't know.
Was challenging.
Yeah, I know, something that was hard for me to deal with as I was trying to do all the other things, And so when I sort of was able to get through all of that, then I thought I need to help those who struggle with the same things as well. So those two areas, right, sort of led me to really want to improve mental health literacy, and where else but in schools where I work, learn, and play all the time. Right.
Yeah. Well, I think you're in the right area, in the right positions to be making a huge impact. And thanks for sharing a bit about your story too. I think being vulnerable and authentic is one of our strongest strengths, right? As individuals, and being honest. So thank you for sharing that, because so many of us struggle even when we do have such supportive upbringing. But the fact that you've seen it, that a lot of people didn't have that gift that you were given, then so no, that's wonderful. I actually didn't know that about you.
Oh, you didn't? You can watch like episode 24 of the Surrey School District Mental Health podcast.
24 out of 100.
I'm not sure it's 24. I just made that number up, but it's one of them.
Yeah. Okay, so I know that we've, in our conversation, have talked a lot about stigma, especially when you were hosting our podcast it was a Surrey School District podcast, but hosting it also on our site and stuff. And, we understand, the importance of mental health, yet stigma still prevents so many people from asking for help. And I was wondering, what are some of your biggest misconceptions that you see that are holding people back from asking for help?
Well, I think one thing is people don't see stigma as a multifaceted thing. They see, okay, well, if I can overcome X, Y, Z, then I can maybe seek help. Or if only I can get to here, I can seek help. But really, stigma comes in all different forms, right? For me, stigma came in my own ego, wanting to look perfect, want to be perfect, want to present a great image. That was my own personal stigma. I think we hear the word stigma and think, okay, people will look down on me if I talk about mental health. Well, I think thanks to people like yourself, Andrea, like we've moved past that in society a little bit, that we can talk about mental health now. Mental health matters, right? That's a phrase that's said all the time, and the Bell Let's Talk Day, and the thing that's run by, I think, Ken Biaksa or some others, right? The mental health does matter. And I think people talk about it, but they don't talk about what holds them back from seeking support. And sometimes it's not even recognizing your own mental health issues to begin with. And we forget that mental health is just like physical health, right? It's a spectrum, and we can feel well one day or sick another day physically, and likewise mentally. It's important to recognize that. And I think that's the greatest stigma of all, is us ourselves not recognizing that we need support and that we need people to talk to. We need positive relationships. We need a great work environment. We need things to do on our downtime. We need all the different aspects that keep us well all the time. It's not just, when we're feeling down, we need to do things to keep us better. No, we work out to keep ourselves physically healthy. Well, we have to mentally work out and really understand what drives us in order to be mentally well. And I think the big stigma of all is us not recognizing that ourselves as people.
Mm-hmm. Yeah, I know that physical health and mental health being treated so separate, even to today.
Yeah.
When it is, imperative, like even sleep as an example, like the last, I had to be in Victoria with my mother for the last 2 weeks. She had an emergency, and I noticed when I got home, everything's good now, but when I got home, my sleep, like I was like, oh, my foundation, right? Because that's physical, but yet that is mental because it affects our everyday things like that.
Yeah. And we often don't, the synergy between our spirit, mind, and body, that synergy needs to be it needs to be in balance, right? And even, when people talk about, here's a stigma word, the hypochondriac, right? People often said, oh, you're a hypochondriac. You think you're sick, but you're really not. Well, for many now, we recognize that that's mental health. When you have, say, family history of, for example, cancer, well, a person who could be seen as hypochondriac could be just worried about that. Because on top of the worries about that, there's worries about, how do I support my family if I'm ill? How do I continue my job how do I pay my mortgage if I'm sick? And that drives someone to be, quote unquote, a hypochondriac. Well, that should no longer be a term of stigma. Do you know what I mean? And so I do. So I think that's that balance in life, right? And that's why I appreciate your post so much. And Andrea and I are friends. I don't know if anybody in the internet world knows that, but we're friends. And I noticed that she was in Victoria with her mother, but she shared about her vulnerability. She shared about, I think you shared about needing a place to stay. If I lived in Victoria, for sure you would have stayed at my house. If you need a place in Coquitlam, game on. You show up in my house. Right in this office where I'm situated, there's a bed right there. You can just stay in the office. You have internet. It's awesome here. And so, it's just, we forget that being vulnerable is part of it and sharing is part of it. And that probably made you feel like when people responded, oh yeah, come live here, or we're here with you, or we're standing by you, we're praying for you, all those things. That fuels your mental health to be able to do the difficult thing of supporting your mom in this medical emergency, And I think we just forget about that synergy so much. And the stigma is us. We are the stigma that holds ourselves back.
Yeah. There's that self stigma and social stigma, right? And so quite often we have it in ourselves that, I don't know, that shame of whatever that is. But thanks for offering that place to stay if you lived in Victoria. But it all worked out well, and I'd hate people reach out to me. So
I know, I saw that. I was so happy. People were like, stay here, come here, DM me,
Yeah, it's wonderful. Okay, switching gears a little. So you've worked extensively with students, educators, and families from many diverse cultural backgrounds. And I was wondering if we could talk a bit, like, how do culture and family beliefs influence conversations around mental health, and how can we approach those conversations with greater empathy? So how does that work for you in your view?
I honestly think different cultures have a different view of mental health. In Chinese culture where I'm from, and my family's from Hong Kong, some family in China as well, there's no word for mental health. It's like a description of, I think people are creating it now, but there wasn't before. And it was almost a description of your mental well-being, but never like mental health or I'm not well. And honestly, I think, and I've talked about this before, it's similar to when we dealt with concussions in the past, right? When in sports, when people had concussions, coaches in the 70s and 80s would be like, oh, you got your bell rung, you feel good, how many fingers do you see, get back out there, right? Likewise with mental health, and I don't know how many times, even as a teacher in the early 2000s, when kids aren't feeling well, or when we see kids who are not happy, it's like, oh, don't worry, things will get better, chip up, it's fine, right? You try to be that encouragement, but really not recognizing that there's mental health. And I think our culture, our Western Canadian, British Columbia sort of progressive culture is now starting to see mental health. But I think a lot of cultures, especially in the Lower Mainland, in BC, in Canada, where we are very multicultural, right? There are still many cultures who don't have that lens, that mental health is really a part of the mind, body, spirit that allows that we need to thrive in order to thrive in society. I love the Canadian mental health definition that includes mind, body, and spirit as well, right? And as well as especially the World Health one as well. I think a lot of cultures don't see that; they don't have terminology for it, and I think it's similar to special needs in other cultures as well. Like in some cultures, they don't understand autism, for example. They don't understand Down syndrome. They don't understand special needs, even blindness. Some cultures don't understand that. Likewise, there's a lack of understanding about the mind and how it affects the body, how it affects functionality, and how the body can also affect the mind. When the body doesn't function, the mind also doesn't function. I just think there's a lack of understanding. Because when I look at other cultures, once you explain it and explain how it affects learning, for example, in the context that I am in, or affects the job, when someone is working in trades, for example, where I'm also doing some work, when that's explained to people in different cultures in their language, then there's a greater understanding. Then there's a reach out for help. And I really think it comes down to lack of understanding about what the issue really is.
Right. No, that makes so much sense for sure. And I think truly at Stigma-Free, it's about awareness, understanding, and acceptance, right? So bringing that message into different communities is obviously challenging, but so needed. Yeah,
absolutely.
Okay. And so talk about your presentations that you give. You often explore how to communicate mental health concerns with parents. So I was curious, so somebody watching this, what advice would you give educators or caregivers who worry they'll say the wrong thing when starting these difficult conversations?
You know what? I think my answer would have been different even a year ago. But now I'm back in the high school working with kids, something I did miss, doing. I love district work. I loved the Surrey School District. Don't get me wrong. Surrey people still love you, have lots of love for you. But now I'm in a school working with kids again. I found that just listening is important. Parents, caregivers, often we rush in with the advice. We're the adult and out of genuine care. I do that with my own kids. My daughter and son, I'm feeling this way about my son's about to go to track provincials, right? And when doesn't do an event well, or when he plays rugby also, when he doesn't play well, you often want to jump in with encouragement and support and advice. But that's not what really he needs, I found. What I found, and again, shout out to my wife for recognizing these things, is that he needs someone just to hear him out and goes, and to let him stew a little bit. And then come in with, well, what do you think you can do better, or where do you think you can change in your technique? Likewise, in a school, when kids aren't feeling well, I think they don't want to hear their counselor or their vice principal or their principal or their district person come in and say, well, you could do this better, or this is some advice you can do, or here, try these next 5 steps to be able to for glory. It's not that. They want someone to hear them out. They want someone to care. They want someone to listen. And then when you gauge, I guess, as a person who may have done it before, or a person who's just listening, you'll know instinctively where to say, well, how can I help? Right. And I think that is really what kids, families who struggle, people who struggle want to hear is, how can I help you? How can I be here for you? And when they say X, Y, Z, and you can do it, do it. But if you can't, then find a way to get it done. Offering unseated advice for a person who may not want it or need it, I think, is the wrong move. And as a parent, for your own kids, even if they fail the test, right? How can I help? Not study harder. Of course, they know that. Like you watch Saved by the Bell and know you have to study harder. They don't want to hear that from parents, right? They want to hear, how can I help? How can I be here for you? And I think
Mhm.
for me, when I talk to parents, is to listen and to offer yourself.
Yeah. People always ask me that question, like every presentation I've ever done at a school. How can I support some, like a friend, even like, youth and supporting friends?
Yeah,
I always say, like, it's better not to go in with the advice army and
yeah,
really just simply listen. Sometimes
yeah,
people just need a listening ear, and that's quite often
yeah,
it. And then as well, too, I think the listening ear thing is good. And then I tell my husband, like, everyone knows I have bipolar disorder, a mental health
yeah,
condition, and so I get down sometimes, and life
yeah.
can be a struggle for those who don't know, who are watching. But I like when he just says, "What can I do for you right now?"
Mm. That's why you married that guy, right? That's why you
Yeah,
married that guy.
yeah, yeah.
Yeah,
And I think it really comes down exactly what you're saying as well. Okay, so let's talk about belonging. This is
yeah,
huge, right? Because this seems to be a reoccurring theme throughout your
yes.
interviews and your educational work. And I'm very passionate about this too. So, why is creating a sense of belonging such a powerful protective factor for mental health, especially for children and adolescents?
Okay, so this is my entire doctoral thesis. So I was able to do the whole presentation in 20 minutes. I'm going to tailor it all down to 2 minutes. Belonging is the critical protective factor because everyone feels they need community. There's no one that thinks they don't need community, even like one friend, right? Everybody needs somebody. I'm not sure. I think that was a song somewhere, somehow. The thing is, when kids are in, like, especially 0 to preteen, they seek connection with their families, right? And that's why you see so many families, of even families where parents abuse their kids or mistreat them or yell at them all the time in an IKEA or something. The kids are always running back to the parents because no matter how poorly they're treated, they still see the family as part of their protective unit, even if it's a horrible situation. As
Mhm.
they grow into preteen and teenage years, they start seeking out that familial opportunity in the community. They start seeking out their own family, essentially, right?
Mm.
And so, but what they do is they generally mimic what they see at home and seek out those things just out of ease. So, kids from an abused family typically, not always, but seek out people who are like that, either abusers or they become abusers. Kids who are from great families usually seek out kids who are more like them, right? So when kids seek out that sort of area of membership, it's so important for schools, churches, community centers, people to give kids a positive sense of belonging because that's what they naturally seek it out. When kids are leaving, almost like pre-leaving your family, right? They go out and try to seek areas of connection and opportunity. Well, you want to give them the positive nature because they're going to seek out whatever they understand otherwise. You want to give them places that they can connect to and belong to that are positive and encouraging. And to me, when kids are lonely, it's because they cannot seek that community that they recognize as something that's like sort of fueling them and filling them, right?
Mhm.
And they can't see that community where they feel like they belong. And when we know that kids don't feel like they belong, that's when mental health takes a dip. They begin to fall into sadness or depression or worse, right? And that loneliness and that lack of connection can really drive kids into a mental health spiral.
Yeah.
And yes, there are definitely, like for yourself, like if you're bipolar or you have ODD or you have I can't name them all off the top of my head right
Yeah.
now, but if you have other mental health like long-term issues, it's even more important to connect with people who you feel like they're your people, right? And it's so important for wherever you are to give you that positive environment. That's why we talk about a positive work environment now. It's no longer just work, it's a work community, right? It's work-life balance. It's that's why we tell people, hey, seek out clubs, seek out a yoga class, seek out a place where you feel like you can connect with the people. Because when you seek out areas of belonging that are positive, again, mind, body, and spirit will feel connected. If you don't get places that are positive, especially in youth, they will seek out negative situations, which could be where they're from. They seek out whatever they know, right, as opposed to what you offer them. right? And so that's why it's so important for schools to give that positive, because you don't know where the kids are from. There's thousands of kids there. So if you offer a positive environment, the kids who are seeking out a positive environment will come to you. The kids who are coming from a negative environment will see, well, this is what it could be. These are the friends that I could have. These are the teachers that I can have. This is the community I can be part of. And they will also start to thrive if you can set up that community that way.
Yeah. Oh, it's
So that's a
inspiring.
I spent 20 minutes on it with multiple
No,
slides.
so good.
Yeah.
And then you often emphasize early intervention. So,
Yes.
what are some subtle signs that parents, teachers, friends might overlook when someone is beginning to struggle with their mental health?
Well, again, early intervention or prevention, I think we talk about these things before there's those subtle signs. Because
Mhm.
when you get to a point, so initial subtle signs, I think actually, I mean, there's two things. I think you should have prevention and intervent and prevent. Really talk to kids even at a young age, kindergarten, grade 1, grade 2, about taking care of themselves. About you have to have your own. You have to have a good community. You have to make sure you take some mental health breaks. You have to make sure you rest and sleep well. And you have to make sure you eat well, but also work hard, right, in school. And you have to give them that sort of. And these are your friends, and this is the group you're with, and these are the people you can rely on for a short period of time. I think you need all of that, but I actually think a lot of it shows up in avoidance in school or in community events. It shows up in avoidance. It shows up in the kid who sits in the corner. It shows up in physical ailments, like, when you're during a lunchtime, for example, when kids are like, "Oh, my stomach hurts, I'm not going to eat." That could be more than just a go to the nurse and take a Tylenol or here's some Pepto-Bismol for children or whatever, right? That could be more, right? I think we need to recognize that when kids either behavior changes, so they're really, really positive, and all of a sudden they're not for a while, or they are experiencing physical ailments where they didn't have before, and a lot of times earaches, stomach aches, headaches, right? Things like that are signs of something else, possibly. Physical traits like bags under the eyes, lack of sleep, right? That show a lack of rest, or kids who are very kept up and all of a sudden become very unkempt. So you can look for those signs of minor changes or physical ailments. But the other thing is, and having dealt with, unfortunately, some self-harm situations, the reverse is also true. So kids who are often super, super sad for, like, you've only known them to be not well, and then all of a sudden they seem perfect and everything's great, but their life hasn't really changed and the life situation hasn't changed, I'd be worried for those kids as well. Because a lot of times that means they're doing something else to mask the pain and to hide it, and nothing much has changed. So I would also, I've learned to dig a little bit in those situations. Oh, you're feeling so much better. You look great. What's up? How's it going? Like, what's changed, right? And sometimes some kids are like, oh, I joined my friends in a youth group and we're doing mountain climbing every single weekend. Oh, to me, that totally makes sense. But if they say, oh, nothing really, I just feel better now. To me, that's, hey, let me ask some more questions, right?
Yeah. Yeah. Okay. And as well, I was thinking too, like, it's really about adopting practices and things we can do to be proactive. And you talk about that a lot. And I was wondering if, say, every school could adopt just one practice that would meaningfully reduce mental health stigma and encourage their young people to reach out for help. What would you want that practice to be and why?
So this is the question I looked at for a long time. Question number 8 from Andrea. If anybody ever gets question number 8, that's the one you're gonna have to look at a lot. I thought about this question a while because, it is hard for people who are not in the mental health realm, whether you are invested in the work, you're invested in the idea of it, or you're a counselor, or you're a person who runs a nonprofit like yourself. It's very hard for them to see that they can do something. I'm not saying that they cannot. I'm actually, in fact, saying the opposite. But especially teachers that I've worked with in both districts, I've often heard, well, I'm just a teacher. What can I do? Yet we often hear, when you watch any YouTube encouraging clip about the one person that makes a difference in a person's life, a lot of times people point to a teacher I've had. Or when you talk to people of, why did you become a doctor, nurse, teacher, lawyer, accountant, CEO? A lot of times they go, well, I remember my grade 5 teacher said that I could, right? And so I think teachers, education assistants, people who support in school, youth care workers, principals, vice principals, people who are not generally in the mental health work. Oh, you can't see the air quotes because my shirt's blue. In the mental health world, often don't see that they can do anything. But I think a simple practice you can adopt as an educator, as a person who works in an office with, or a person who just, even if it's not just with youth, if you work in an office and you see people around you, is to genuinely check in.
Yeah.
Like that's the one simple practice we can all do, is to genuinely check in. Because when you genuinely, so not the, hey, how you doing? I'm great, thank you, and then just walk away. Like we're not like, I like, you know, the hey, what's up? Even if you give a high five and you walk away and it feels good, right? Often when people greet me, they're like, how are you doing? And I'm saying I'm living the dream, because I am. But there are times that I've said, no, I'm doing okay, and people still walk away. I literally am the person that answers I'm awesome all the time. So when I don't answer that I'm awesome, shouldn't you check in?
Yeah.
Right? Like I literally answered I'm awesome 99% of the time. So there were times last year and maybe the year before that I didn't answer that I'm awesome. Or when my father-in-law passed away in November and people asked how I was, I'm like, I'm okay. I'm like, and my friends knew that to check in, you know? And I think we just need to check in, not just the, hey, what's up? You know, I've had kids in multiple schools that I've worked in tell me that, you know, the one thing that they appreciated was that I asked how they were doing in the hall and that I checked in with them for like more than 10 seconds. And really, more than 10 seconds only means like a minute. I'm not talking I had like full out conversations with them in the middle of the cafeteria, right? But I've had kids tell me, man, like it felt like you're the only person, you're one of the only people who saw who I was out of thousands of kids. And I think back, like, what did I do? I said, all I did was ask them how they were, ask them how their family was, and ask them, you know, how school's going. The fact that I checked in with more than just what's up mattered to them, right? And I'll tell you who I learned that from. I'm going to give credit to Rick Ryan, who's retired but was the deputy superintendent in Surrey and also in Richmond, and he taught me that when I was a young teacher. And I went into his office, I remember one day, and just was talking about, I don't know, I taught his kids as well, and shout out to them. They're awesome. Rick's kids, you're great. But I went to his office and just said, hey, what would you like to meet about? He's like, wait a minute. How are you, Daniel? I'm like, I'm good, Rick. How are you? He's like, well, how's your family? And I said, oh, they're great. Michelle's awesome. I didn't have kids at the time. They're awesome. Like dad and mom are great. He's like, okay, well, that's good. And I thought, does he want me to ask him this too? I'm like, Rick, how are you? Like, do you know what I mean? It was just unnatural for me to say, to walk into, at the time I think he was a director, like, how are you? Like, ask him those questions. But then I said afterwards, I'm like, Rick, why did you ask me? He's like, well, I don't want to just get into having a conversation. You taught my kids. And you're someone I care about. Why wouldn't I ask? We don't have to start off with a business meeting. We want to start off with a personal connection. I never forgot that. Never forgot that. And so checking in, that's my long way of answering and giving a shout out to Rick Ryan, who hopefully will watch to the 33-32 point of this conversation, that if school could adopt just one practice that would meaningfully reduce mental health stigma, encourage help seeking, why would I want that practice to be? Is that every teacher, every EA, every youth worker, every principal, vice principal, janitor, to when they see a kid or see a family, to genuinely check in.
Yeah. Nice. And lastly, this is our last question. I was wondering if there was somebody out there who was struggling and they were maybe considering getting help but felt hesitant. What kind of advice would you give that person?
I would definitely, first of all, talk to someone that you can connect with. It doesn't matter who that person is. They could be, again, the janitor at your school. They can be, even if it's the person at the Starbucks. I don't care who it is that you feel like you connected to. Please tell that person you need help. Because even if they cannot help you, I can guarantee you that the person that you feel connected to will find help for you. I think that often we don't want to seek help because we are scared of who we will run into, We are scared of, we go to that office, what will the nurse think of me? What will people think of me if I go and seek help and I recognize these people and they recognize that I'm actually a mental health worker, that I need now mental health support? What if I go into a doctor's office and say, don't you do this for a living? Why would you need help from me? Like, they're afraid of the reaction. So if you go to a trusted person, you can almost guarantee the reaction will be like, I'm here for you. I think every person at least has one trusted person. You may not think that you do. You might live a very solitary life, but I bet you, even if you live the most solitary, unfriendly life, that you have one person somewhere that you see every single day, whether it's at a Starbucks or on the bus or, I don't know, like just having coffee somewhere on a deck. There must be one person you see every day, and to even go to that person. And sometimes it doesn't have to be too familiar a person because you don't want that, but someone that you feel that will find help for you. Like, I just need some help right now. I know this is super weird, but can you help me? And I can guarantee that person will try. I can guarantee you that person will try. And even you saying that to that person might respond, I don't know how, but let's do this together. Like, that sometimes is enough.
Yeah. Or sometimes refer you somewhere, right? Because there's a lot of those great organizations out there. Sometimes people may have resources that we don't know they have.
Yeah. And if you're that person when someone is asking to help you and you don't know how, those resources are all awesome. Stigma-Free, from the Stigma-Free Society to Child Youth Mental Health to governmental agencies to sources, nonprofits, to any of the nonprofits out there, please utilize the community resources that we have in BC. And where are you now? Saskatoon, I believe?
Manitoba? Saskatchewan.
Yeah, I'm right. I got the right province at least. And like, Andrea's gone almost national now. We have so many different organizations in Canada that want to care for you and that want to support you, that want to help you, and that want to help your friends. So if you have a friend that is, or someone just like walks by you in a Starbucks, don't just like, oh yeah, no, I'm good. Like, I don't need to talk to you. No, take the 30 seconds. You just Google mental health supports in my community in Burnaby, Coquitlam, Surrey, blah, 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 and help that person and get them there. You don't have to necessarily stay with them, but get them there, right? Don't ignore someone who's asking for help. And if you need help, realize there's help out there for you all around you.
Yeah, we really encourage people as well, come to stigmafreementalhealth.com. There's a help tab. And we don't make it overwhelming. We have about 12 sources per province and territory. So that's a really great place for people to come. And we just ensure that directory is always up to date and people can visit us there for sure.
Well, and I have to say, your website from when you first started to now, you first started as Bipolar Babe, which is when I met you at I think you were speaking at my friend Sam Sullivan's event. Is where we
met. It was bipolar. Well, we were running the Bipolar Disorder Society.
Yeah. And I remember the website then and what it has become now, and the resources you have for schools and communities and counseling centers, and that now you're nationally known as an organization that just deeply cares about prevention and about mental health and wellness. I love that what you're doing, and I just can't be happier for all the success that you've been giving. You've worked so hard for it, but all of it was to help the community and to help people in Canada. I can't believe that you're helping people in Canada, not just BC, not just Alberta, but you're just going across the country supporting people who feel like they have no support, which I think is fantastic.
Thank you so much, Daniel. And we really appreciate all the support you've given us as well. So thank you everybody for watching. We are so grateful for every guest we have, and for Dr. Daniel To has been a great support to Stigma-Free. We can look forward to continue working with you. So thank you.
I wear a different shirt next time, I promise.
Yeah, that's great. Don't worry about it. Don't worry about it. All right. So everybody, again, on Spotify, Stigma-Free Voices, please leave us a rating if you enjoy our show. Please share. Also, again, on LinkedIn, Facebook, and on everywhere, podcasts are shown. Soon to be Apple, though.
I know you don't normally do this, but you're a nonprofit society, aren't you?
Yes, of course we are.
Well, people donate to Stigma-Free Mental Health Society. My goodness, you like, even if you give $20, you get a tax receipt, so you feel better. The tax person will give you a bit of a credit, but you're supporting a wonderful organization. So if it matters that I'm trying to encourage people to give a little bit of money, please do. It helps people all across the country. Your dollar will be stretched far.
Thank you. Thank you, Daniel. Okay. Thank you, everybody. Have a wonderful rest of your week. And remember, let's live stigma-free. Thank you.